This infection quite common in daycares and hospitals in the colder months, especially as people have longer hospital stays due to illnesses such as pneumonia. Researchers at Xavier University found a simple bed protection system made by Trinity Guardion in Batesville might help fight this problem in a whole new way. We asked the experts at TriHealth to explain how.
In elderly patients, it has about a 20% mortality rate, so it's a very severe infection.
Dr. Stephen Blatt is an infectious disease expert, and what he is talking about is a common infection that spreads easily this cold weather time of year. It often follows complications from the flu and pneumonia when more people are put on antibiotics to fight off lingering symptoms of these illnesses. It's called Clostridium difficile, better known as C. diff.
It's a bacteria that overgrows the bowel and then starts producing a toxin that damages the intestinal lining and leads to terrible diarrhea, dehydration, and sometimes organ failure.
Hand washing is the best way to protect against C. diff, but surfaces have to be well cleaned to kill it off between patients in something such as a hospital room. Dr. Ed Hooker says cleaners can work well on hard surfaces, but soft ones such as mattresses can be a problem.
None of the cleaners that are currently available to hospitals are approved for soft surfaces.
So Dr. Hooker, who is a public health specialist, decided to head up a research team to study this bed cover. It's part of the Trinity Guardion bed protection system. He wanted to see if it could be one more tool in the fight against C. diff. His team then compared beds without that cover, especially looking at infection rates of C. diff, and what they found was pretty remarkable.
We actually did studies here in Cincinnati, Cleveland, and Indianapolis where we said, clean the bed as good as you can clean it, and now let me culture it. And I can grow all sorts of lovely bacteria all over those mattresses after they're officially cleaned.
In fact, his research on this cover, now published in the American Journal of Infection Control, in some cases found that it could cut the risk of C. diff infection in half. Dr. Hooker's team found not only did the cover provide a protective barrier to C. diff, but when removed and washed,
it kills everything. It kills all the bacteria.
And the system has a way where you can even find tears by shining a light under it after washing, so they could actually patch up those tears. Wow. So you could use it longer. And either way, even when you patch the tear, he still found that was an effective barrier in preventing that C. diff.
This sounds like very important research because, you keep hearing stories about MRSA and other things that people go into the hospital for something small and end up with some whopping infection.
Or what happens is you cure whatever they came in there for,
right,
and then they leave with this.
Exactly,
absolutely,
yeah.
And that's why it's exciting that we're shining a light on our area, kind of coming together.
For sure.
And he did the independent research.
Yeah.
As always, if you have questions about something like this you'd like to ask our providers at TriHealth, go to local12.com, click on Ask the Expert. We also have a link if you want to find out more about that bed protection system. I bet we'll be hearing about it.
All right, thanks, Liz.